Today we're going to be talking about workers' compensation trends and the new experience rating formula. I'm sure many of you are eager to learn more about this and understand how it's going to affect your business. During the presentation, there are going to be two ways that you can ask questions, and we're going to try to get to all of those before the end of the presentation. So hopefully the PowerPoint itself won't take very long, and we'll be able to answer some of your questions that do come up during the explanation of the changes. So please just type those questions into the question box that's showing on your screen, and I will be able to see those, and towards the end of the presentation, or maybe as questions come up and I'm able to, we'll answer them as we go. So certainly feel free to ask any questions that you have. Today we're going to be talking about some of the trends that are causing the change in the new experience rating formula. This is brought to you as part of the HNI 2012 offering, and these are our sponsors currently, and we want to thank them for making this possible to bring this important information to our clients. In this presentation, we're going to talk briefly about the overview of the experience modification factor. We're going to talk more specifically about the split point change. So we'll talk a little bit about the mod factor, but we're not going to get too detailed into the formula. And then we're going to talk about some ways that you can help control your mod. First, we're going to start at the beginning, Workers' Compensation 101. Workers' compensation has been around for over 100 years now. The first law was passed in Wisconsin. It provides payments of medical bills, lost wages for work-related injuries, and it's a no-fault system. Prior to the enactment of these laws, employees were able to sue their employers and seek punitive damages for pain and suffering. Now the sole remedy for an employee when they're injured on the job is to be paid their medical bills and lost wages through workers' compensation insurance. Once the laws were passed, the insurance became compulsory in every state except Texas. Premiums are based on a function of your payroll, the class of business that you're operating in, and your experience modification factor. There are other state programs that have specific factors, other credits that states have. So this isn't the final calculation of your premium. There are other things that go into that. However, these are the main functions of that premium calculation. But the one component that you have the most control over is going to be your experience modification factor, which we'll continue to refer to as mod for the presentation. So what is the purpose of a mod? Most states utilize the National Council on Compensation Insurance to gather the data necessary to manage the experience rating system and to publish mods. Some states have their own bureaus. Wisconsin is one of those. Michigan is also one of those. And they use similar rating systems and data gathering systems to come up with their final mods for their clients. If you're interstate rated, which means that you're operating in more than one state, you're likely to be rated under NCCI even if you have operations, let's say in Wisconsin. Sometimes you'll have a mod that may be a Michigan-only mod, but you might have a mod that's an NCCI rated for another state that you're operating in. The mod itself is designed to measure whether your company's losses are better or worse for the expected size in your industry. So if your losses are worse than expected, you should expect to have a mod of 1.0 or greater. You pay more for your workers' compensation insurance when your mod is that high. If your experience is better than expected, that results in a lower rating, something under 1.0, and you're typically going to be paying less than average for your insurance. This typically is a system of punishment and reward. The Bureau wants to make sure that companies are being incentivized to make some changes and have some responsibility over their losses. So the theory behind the mod is that it's going to incentivize your organization to work more safely. And really it's putting in a process that balances fairness and responsibility. It could be potentially devastating to some organizations to bear the full burden of their claims. This is one of the reasons that the formula splits losses into primary and excess components. We will discuss that a little bit further. It's accomplished through the complex formula, which takes into consideration both your company size, your unexpected accidents, and then differences between loss frequency and severity, which is specifically the split point. But there's been some misunderstanding. Most companies believe that a 1.0 mod is good. Well, 1 is average and is similar to accepting a C on your child's report card. In our home, our girls get a little reward for A's and B's, but they don't get anything for C's. We know that the incentive to get the reward will make them study harder to improve their grades, and truly that is the basis behind the experience rating. Besides the impact on your premium calculation, the mod is particularly important for organizations that have contract requirements or bid for work. Construction companies and others are hit particularly hard when they have an unsatisfactory mod of 1.0 or higher. When others see their rating, they assume that they are unsafe organizations and may choose not to work with them. Government entities and others have strict rules that bar working with contractors and vendors with certain mod ratings. Later on, we're going to discuss some ways that you can help decrease your mod and control those costs. But let's talk about the formula. It looks complex. It's really can be complex. We're talking about ballast values, weighting values, all of these numbers, and they kind of all jumble up. But in very simple terms, your mod is the ratio of your actual losses to your expected losses. So there are some stabilizing values, some D ratios, some ballast. The worksheet that you look at is very complicated. It does not look like a simplistic form that's going to explain to you why you're getting the mod that you get. So we're going to delve in a little bit deeper and hopefully explain some of that to you. But truly, your actual losses and your expected losses are what determine your rating. So the closer you are to your actual and your expected, the closer you are to 1. If your actuals are under, you're under 1. If they're over, you're over 1. So how do your expected losses get calculated? Your company's expected losses are determined using the following formula. Expected loss rate divided by 100 times your payroll. The expected loss rate is different for every state. It's determined by the Bureau and is very class specific. For example, if 100% of your payroll is classified as clerical, the loss rate is 0.14. Then your expected losses are $140. So obviously, clerical staff, we don't expect that to be a high-risk category for employees to be categorized in, and so we're not expecting you to have a lot of losses. So should you be mostly categorized as clerical payroll and someone should have a catastrophic injury, or if you have multiple injuries, you might be affected a little bit harder because your expected losses are so low, and if your actual losses are much higher than that, that actually could be adverse to you. But likewise, if $100,000 of your payroll is classified as pile driving, the expected loss rate is 10.73, and your expected losses then become $10,730. So there's a big difference here between how your payroll is classified, what class of business that you're operating in, and what your expected losses are going to be. The next thing that we want to discuss is frequency versus severity. You've probably all heard your agents talk to you about this, that frequency leads severity, and that frequency is really what drives your rating, and they're right. After your expected losses are calculated, the next step is to split the losses into primary and excess values. That's what we refer to when we talk about a split rating. So for all of you that have continued to hear that the split rating is changing, these things are going to be in effect, that's what we're referring to. We're truly referring into what are your primary losses versus what are your excess losses. So the purpose of that split rating is to emphasize the number of losses over the amount of your losses. If you were an underwriter and you were analyzing a company with $100,000 in losses, which would cause you more concern? A company with $20,000 or $25,000 losses, or with two $50,000 losses? Remember that in our case, we want to keep our actual losses low. If there are 20 losses and the first 10,000 of each goes in as calculation at 100% of the value, might be more dangerous for your company than if 20,000 of those first losses go in. So let's talk a little bit more about the split rate. This is what we're talking about when we're making the change. So for the past 20 years, that split rate has been at $5,000, which means that the first $5,000 of your actual losses are going into your calculation at 100%. Everything above that amount is being weighted differently into the calculation. Well, the average cost of a claim has gone from being $2,500 in 1989 to being $8,800 in 2011. This is obviously a very big jump, and this kind of leads us to some of the trends that are pushing a lot of different areas in society right now with medical costs. Medical costs are skyrocketing, and workers' compensation is one of those areas that is being deeply impacted by that. You might already see that in the cost of your claims increasing. You may have had a shoulder claim 10 years ago in your organization that maybe cost your organization or had a total incurred value of maybe $25,000 or $30,000. Well, that same shoulder surgery now might cost somewhere between $50,000 and $60,000. So this means that the current MOD formula is not responding to the current conditions. Therefore, most states are going to be initiating the new split rate change with an increase to $10,000 in 2013, and there will be subsequent increases. So what does this all mean? It results in your MOD. We take a look at your actual losses to your expected losses, and we come out with your MOD. Hopefully this is not your MOD. 1.6 is not something to be proud of, and so we certainly want to be working on getting that down. So how is this going to phase in? Beginning in 2013, NCCI and similar agencies will begin to phase in a multi-year increase of the split point used in the MOD calculation. So next year, we're going to start seeing this. Some of you may have already started getting your ratings for 1/113. If you're NCCI rated or in a state where your rates are published as of 1/113, you might already be affected by this change. So you'll see the first change happen next year. Then in 2014, we're going to see another increase. That increase is going to be from $10,000 to $13,500. Then in 2015, you'll see another slight increase, which is calculated right now to be $15,000 plus 2 years of inflation adjustment, rounded to the closest $500. So I've seen a lot of misinformation out there. A lot of information is saying that it's going to go from $5,000 to $10,000 to $13,500 to $15,000, and that there's going to be a cap out there. But that is not truly what's going to happen. In 2015, you're going to see $15,000 plus 2 years of inflation, and what they're estimating right now is that it's truly going to be somewhere around $17,500 for that year. And then every year after 2015, we're going to see an inflation adjustment being made. So gone are the days of having one number that's going to remain the same for the next 20 years. These numbers will continue to change into the future until at some point, if anyone feels that they're no longer being responsive again to the data or the plan, or that they're unfairly burdening employers. Here's some examples of some of the published rates. I know that many of you on the phone have operations in other states besides Wisconsin. That's where I'm coming to you from right now. Illinois, Iowa, Michigan, Minnesota, all of those rates are published 1/1. And so it's important to know that if you have a 1/1 rating in 2013 or later in just those states, you're going to be impacted immediately with this change, and you might have already received your rating. If you have a later rating date in 2013, you'll probably see those coming in the next few months. So definitely expect to see those. I wanted to give you a couple other examples. North Carolina and Tennessee have different rating dates. So there are also some other states out there that have different rating dates. We're not all rated 10/1/1. So Wisconsin is rated 10/1. So for anyone that's on the call that has a Wisconsin-only operation, if your rating or your renewal date is after 10/1/13, you're going to see this change. If your next renewal date of your rating is somewhere between 1/1 and 10/1, you will not be impacted by this change until the following year. So there will be some lag. One of the common questions that I get asked about this is whether or not the split point is retroactive, and it is. That means that it's applying to all the losses that are being used in your experience modification class calculation. So for every experience year that's on your rating, all 3 years, this new split point is taking into effect. So it's not going from 2013 forward. This is affecting all your prior experience and going into your calculation. So what does that mean to you and to your organization? Right now, NCCI is estimating that 70% of businesses will be experiencing just a modest change. Well, obviously modest to some is not the same as it is to others. So you may see an increase of up to 2 points or a decrease in as many as 5 points. Obviously, we would hope for our clients that you're going to see a decrease. Businesses, the remaining businesses outside of that 70% are going to see a much larger swing in their rating. But who's going to be affected the most is going to be those businesses that have a higher frequency of losses. They have lower severity. They're going to be ultimately more affected by the change. So if you have a lot of smaller losses that fall between 5,000 and 10,000 on your experience rating, you're likely going to see an increase. So you can take a look at your rating worksheet right now and have an idea of what you might experience. Because prior to this change, if you had a $10,000 loss on your rating, 5,000 of it was weighted at 100%, and the remaining 5,000 of it was discounted. Not anymore. Going forward, that whole 10,000 is going to be in your actual losses at 100%. So there will be some balancing in the formula by the rating bureaus. So that's why it's very difficult for your agent right now to fully predict how it's going to affect your rating in the future. So we can do some projections. We can take a look at what your rating right now would change to if the split point changed. So that's something that HNI is able to do for our clients and some of our prospects. So if it's something you're interested in seeing, definitely contact your relationship manager or your account executive. We can get those reports for you. So even if your rating isn't scheduled to change until after 10/1/13, you will be able to see if I took my rating now and I changed this effective date of the split point change, how many points would I see an increase or decrease on my rating? It's obviously very important for planning purposes, but ultimately you can't change the past. You can't change the experience that you've had over the last 4 years up to this date. All you can do to manage this change is to change how you're operating for the future. So we're going to talk a little bit now about some of the ways to control your rating. This is the best time to re-energize your safety program. If you've always thought you're going to get a safety program together and you haven't done that, this is the time to do that. Get your safety committees up and running. Get someone engaged in your organization. Use all the resources that you have. Use your carrier resources. Use your agency resources. Review your safety program or start one. Work with anyone that you can find who will help you. But safety culture is important in an organization from the top down. So make sure that it's a priority. Make sure that your leadership's involved and that you're communicating to everyone that this is a new safety culture or that you're re-energizing your safety culture. Kick it off. Have a meeting. Get people excited about it. The only way that you're going to manage these changes in the rating formula is by creating a safer workplace. Formalize your modified work policy. If you don't have a policy, get one. If you don't know how to write one, ask for help. Talk to a risk advisor, talk to your agent, talk to a relationship manager. There are resources out there to help you come up with the proper modified work policy and the best practices for utilizing that. And by modified work, we're talking about getting employees back to light duty after work injuries, because medical-only claims receive a 70% discount in the calculation for your mod. So when you have a claim that goes in at $5,000 or $10,000, it's actually discounted 70%. So a $10,000 claim goes in at $3,000 if you can keep that person working the entire time and they don't go out of work at all. So definitely get a modified work policy in place. Use all the resources that you can. And also, as you're doing this, make sure that you're in compliance with federal and state regulations, such as FMLA, COBRA, and ADA. So work with your resources. Make sure that you're putting these policies in place, that you're not, going up against any federal laws. You're doing everything that's the best practice, and you have a solid, consistent program. Better claim management. Your workers' compensation adjuster is not managing your rating. They are managing a claim. This is very important for everyone to understand. You pay for insurance. We know you pay a lot for insurance. But your adjusters are managing the claims as they come through. They are not managing your future work comp premium. So you need to be involved. Maintain close contact with your adjusters and with your employees. Make sure that there are no delays in treatments and that your employees return to active duty as soon as possible. When you don't maintain contact with your employees, they tend to become disgruntled. They tend to feel that no one cares about them, and that's when we see a lot of claims go into litigation. And obviously, when a claim goes into litigation, the costs go up. And so if we're trying to manage the cost of your claims, it's very important that you engage with your employees, let them know you care about their injury, let them know you care about their return to work, in a sympathetic way, not in a way where you're trying to tell them that they're impacting your costs, because that's another way to make them feel that they're not worth anything in your organization. Another tool is to utilize a 24/7 nurse triage service. A lot of carriers out there have their own services, so you can utilize those. Secura has a service, Acuity. There are a lot of carriers that have these types of services, but there are also independent vendors that you can engage, and it might have a minimal cost to it. But ultimately, your injured employees are going to be calling in, talking to a nurse, and they're going to be referred to the appropriate level of care. They might even be referred for self-care. They might not need to go to an emergency room. They might not need to go to an occupational health clinic. So we really want to make sure that we're capitalizing on utilizing nurses for that reason. It's another great option to have a nurse on site. If you have a work site that has a large number of employees in one location, consider putting an health nurse internally on site with one of your offices. Even if it's just part-time, your employees will really feel that you care about their health and that they're not going to suffer work injuries, and that it's important to you. And they're going to utilize the service, and it's going to cut down your claim costs. Don't hire your next claim. This is really important. When you're going through the HR process, make sure that you're doing pre-hire, post-offer physical capability testing. It's a lot of words jumbled together, but ultimately you're making sure that the people that you're hiring can do the essential functions of the position that they're being hired for. That step, putting this into place, means that you need to get updated job descriptions with specific physical requirements. Some organizations may not have job descriptions at all. Some are outdated, and many don't have any specific physical requirements that go with them. So take it a step further. Put some time into this. Get some job descriptions together. Again, use all the resources that are out there for you. Talk to your agent. Talk to your relationship manager. Talk to your carrier. Talk to HR professionals. Join groups that get together to specifically talk about these things. But really go beyond drug testing. Do something a little bit more. It's going to save you in the end. And then managing your experience. This is an important part of the process that you kind of take out of the claim management realm, because we're not just talking about claim management. We're talking about the money and the data that is going into this rate unit stat filing. Now, your unit stats are filed for your rating 6 months into the your renewal. So if you're a 1-1 rated mod, your unit stat filing is going to be 7-1. So we want to review all those reserves prior to that unit stat filing. Now, based on what the plan of action of a claim is, sometimes you might find that some of those reserves could be lowered. You might find that some of those claims can be closed, or you might just confirm that the reserves are proper as the adjuster has them set. But this is something that your current broker or agent should be working with you on. They should be doing this for you, and this is a primary part of my job here at HNI, is to make sure that all of our clients' reserves are in line and their payroll information is correct prior to that unit stat filing. Project what your future rating will be. Again, as I mentioned before, HNI has the capabilities to project what your rating is going to be with a split point change, and we also can project from year to year what your rating is going to change to. Once that unit stat filing is done, we take that information, we have a software program, and we're able to tell you what you can expect on your renewal. And then audit your rating. We find tons of errors. We have a program formally in HNI where we review everyone's rating, and we look at all their losses that were recorded at the time of the unit stat filing. We look at all their audited work payrolls, and we find a lot of errors. And they're not always carrier errors. Sometimes there are areas that are specific to rules and states where we can make some corrections. In Michigan and also in Wisconsin, being two examples, there's what's called an aggravated inequity rule. In that rule, if a claim goes into your rating at full value at the time that the unit stat is filed, and then it closes sometime between the unit stat filing and your next renewal date. So if it gets entered in July and then by 1/1 it's closed, your agent can specifically request that that information be refiled for you with the Bureau, and you'll get a new rating and hopefully a lower premium by substantial amounts. So ask your agent how they can help you. Feel free to contact me directly after the presentation. I'm pretty much finished with the discussion, but I want to talk about some questions that we have. So one of the questions that I received is, if my renewal date is 9/1, and I know that the new split point formula will benefit me in my mod factor, what can I do now to get my renewal date changed to be after the 10/1 effective date for Wisconsin? Now this is kind of a complex question, but I'm going to answer this in a couple fashions. First, I'd say that this is not the best idea. The reason for that is when you change your rating effective date, in order to figure out your experience years on your mod factor, it works backwards. So you could, in effect, be tacking on more years in your experience rating calculation than you're required to. So right now, you're only required to have 3 years of experience in your rating. Even by changing your rating by 1 month, that could mean that you could hold on to a whole year's experience because they don't break up full years. So you could change it by 1 month, and you could end up holding on to a whole year's experience that would eventually drop off. I would suggest just waiting until the change affects you. We can definitely take a look together at how your projection will stand, how many points you would save, and we can predict out what those changes in effective dates of your rating will affect you. So hopefully that answered that question, but ultimately there are quite a few factors that go into that change. I wouldn't necessarily make that change without discussing a little bit further with your relationship manager or your account executive. We will have a copy of this presentation on HNI's website afterwards. The webinar is being recorded, and I believe all the slides will also be available to you. And I have another question here about expected losses. Are the expected losses going to be adjusted to reflect this upcoming change? And yes, the expected loss formula is going to be adjusted similarly to the actual loss formula. So your expected losses will be proportionate to your actual loss change. So from a carrier standpoint, you've probably heard a lot of people saying that this is a premium neutral change, which overall means for work comp in general, for work comp insurers, they're not going to be making more premium because of this change, because overall it's going to be neutral. Some of you are going to go up, some of you are going to go down, but ultimately it's not premium neutral to your organization. So that's what we need to be focused on. You may continue to hear premium neutral change, but it's really not premium neutral to you. I've got some time for a couple more questions if anyone wants to send any over real quick. Otherwise, I pretty much have gone through what I wanted to discuss with you today, but I can hang on the line for a little bit longer if you've got more questions. Otherwise, please feel free to contact me directly. Contact your team here at HNI. If you have a contact and you're just a prospect and you're not a current client and you have more questions, they can get you in touch with me as well. So certainly feel free to move forward with that. And we'll leave it open for a few minutes again if there are any questions. We've got quite a few attendees on, so hopefully if anyone has any questions, you can send them over right now. Nobody asked this question, but I was just thinking that this might come up after you get off the call. One of the things that comes up frequently when I'm talking with insureds is, if you're operating in different states, how will this affect your rating? So if you have operations in Illinois and you have operations in Wisconsin, and you have a 1-1-13 rated mod, you can expect that your rating information for Illinois is going to have the new split rate on it. But the rating information for Wisconsin is going to have the old split rate information on it until after that rate published date of 10-1. So you might see this with interstate rated mods going forward, that you're going to have multiple states that might have different split ratings on the same calculation. So it could get confusing as we go further into the multiple years. So for every year, you might lag a little bit if you have interstate operations with states that don't have the same published rating date. If you go to NCCI, the National Council on Compensation Insurance, you should be able to see the states that are affected by the NCCI Bureau, the ones that adopt their rules, and you should be able to see when the changes to the split rate will take place for those specific states. As I said, a majority of them are 1-1. There are a handful, probably 10 states that have different effective dates. Another question, do you ever see work comp being based on hours worked versus dollars, since that is a more accurate base? No, we typically do not see that, because it would be very difficult from a rating standpoint to break that out, as classes of business do handle things differently. So unfortunately, when you're looking at maybe your OSHA DART rates, you're looking more specifically at hours, but when you're talking about your experience rating, we're just talking about the function of payroll dollars versus your losses. So unfortunately, I don't see that changing any time in the near future with how the data and what data is being used. I think that would take a whole overhaul of the system. I'm not sure if I have anything else that I'm thinking of that I need to add to the commentary here, so I'm going to stay on for one more minute. I do have a commentary here. Someone on the call had an erroneous claim that was attributed to them. The employer names were similar, and it affected their rating. They were not able to get the mistake corrected. What's the best way to accomplish a correction like that? I would suggest that you contact your representative, your agent or your broker. They should be able to assist you in doing that. You certainly should not be affected by another organization's employee's injury. I do have a customer right now that is experiencing a a similar situation where there is a company with a similar name in Michigan, and they were brought into a work comp claim in Michigan where they were named as the employer. Both employers were actually named. What their work comp carrier did, kind of at the request of HNI, was to only put reserves on that claim in expense. So only expense was put on that claim, although they have to defend our insured because they're named in a lawsuit, and under the contract they're required to do that. We convinced them that it would be an unfair disadvantage to our client if they did not put that dollar rating in expense. Expense does not go into your rating calculation. Only medical dollars paid and indemnity paid. So that was how we got around that with that client. But ultimately, if a correction report needs to be made and it is a strict correction of wrong employer, we should be able to work with whatever bureau that you're working with to get that accomplished for you. And we would be able to help you with that. And if anyone has any other questions, I'll hang on for just a couple more minutes. We still have quite a few attendees online, so if you're interested in asking a question, we've got a couple more minutes. Otherwise, we'll stay on until about 11:45. We'll stay on for about 5 more minutes if you have some questions. Right now I don't have any current questions. If you're on the call and you'd like to see one of those reports projecting your rating with the split point changes, please make sure you contact your team, contact your agent, and we can get one of those reports run for you. We can also help you project your rating. Again, this is something that HNI does for their clients, and you should be getting that information currently. So certainly give us a call and let us know. We'll get that working for you. Another question I just had pop up was wanting me to confirm whether or not smaller claims affect your mod rate more than the larger ones. And this goes right to the heart of what we're talking about, really. Small claims are medical-only claims, like I had said during the management part of this presentation. Those are reduced by 70%. A lot of times I hear that employers are maybe paying claims out of pocket. They're paying a small medical-only claim of, let's say, $1,000 in order to keep that off their rating. Now, I can show you through reports and how we can break down your premium that by you paying $1,000 outright, then you're not going to be saving that much money in premium. So you're going to pay $1,000. That claim would have been discounted 70% and put into your rating at $300. And over 3 years' time, as your premiums split out over 3 years, that claim is affecting your rating, you may have paid an increase in premium of $500. Instead, employers are paying $1,000 out of pocket to save $500 over 3 years' time. So that's specific to medical-only claims. Those medical-only claims do affect your mod, but not as much as lost time small claims. So going forward, any lost time small claim that is between $0 and $10,000 is going in at 100%. So if you have more of those small claims, it's going to impact your mod more than if you have 2 claims that are $100,000. So if you have 4 $10,000 claims, it's going to have more of an effect on you than if you had 2 $20,000 claims, because of the way the rating formula is weighted. So that was a great question, and definitely the smaller claims that are more frequent are going to affect you much more than larger ones. But if you have a small frequency, small claims and small frequency, you're going to still have a good rating. It's the small claims that are more frequent that are really going to impact you the most. HNI, with those reports that I was just discussing, we don't charge our clients for those reports. That is something that we do for all property and casualty clients, just to make sure that we are keeping up with what their losses look like, what their open claims are, and we consistently find errors. I think over the last 3 years, we've saved our clients almost $750,000 in premium just through errors that we've found. I think this speaks to what HNI's purpose really is, and that's creating a better business relationship with our clients. We get paid less if you have less premium. So ultimately, if we're here and we're trying to make sure that your mod is better and that you're doing better and that you're working safer and that you're managing these things better, ultimately we're getting paid less on our commissions from that premium reduction. So it really shows you the kind of commitment that we're making to our clients and helping them to achieve a better growth in their business. So it's no charge to our clients to do those reports. So again, please, if you're interested, let us know. We'll get those out to you. It's about 10:45, and I haven't had any other questions pop up. So I want to thank everybody again for attending today. If you have any follow-up information or comments, feel free to email me or contact me here at HNI. Otherwise, we hope everybody has a great day.